Hi, I'm Dr. Meredith Warner, and I'm an orthopedic surgeon specializing in foot and ankle surgery. And I want to talk to you about something super basic but super common. Basic foot pain, or plantar fasciitis as we commonly think of it. What is plantar fasciitis? Well, let's start with what's the plantar fascia. Plantar is just a fancy medical term for bottom or under. Fascia is any sort of like gristle. Think of it like the stuff around sausage, that white filmy layer around your steak, any of that like thick white stuff on your chicken bone. All of that is collagen. It's a protein-based connective tissue. It's a structural tissue in the body, and that is fascia. So the plantar fascia is simply a thin sheet of gristle, for lack of a better term, on the bottom of the foot. What does it do? It is the tie rod to an arch. So it connects the calcaneus to the forefoot, okay, and gives you a tension band. See how really shouldn't let your foot break like that, okay? It gives you the tension band to your longitudinal and your transverse arch when you're weight bearing. So when you load yourself, when you're standing, running, walking, the plantar fascia serves as sort of a passive restraint, a structural, I guess an architectural way to balance your body and help you stand upright and support your weight against gravity. In addition, the plantar fascia has this neat feature where when the great toe bends, it automatically tightens, automatically locks the transverse tarsal joints and kicks the heel inward. And that alone makes your arch bigger, okay? So just by passively lifting your big toe, you can self-support your arch. So plantar fascia is a beautiful, ingenious, amazing design feature in the human body, which in itself is amazing. The other beautiful thing about the plantar fascia, when it starts to hurt, it does have the ability to self-heal. But what do we do in medicine? We jam steroids in it. We cut it. We immobilize it in a cast. We do all of these crazy things that the human body was never really meant for, and all of them are detrimental in and of themselves. Steroids cause changes at the cellular level, at the DNA level. They actually decrease fibrocyte production. They increase the rupture rate. They cause fat pad atrophy, skin depigmentation, and even though steroids do offer a short-term Band-Aid pain relief, most pain comes back. Most of the relief lasts a year or less, if even that, and then you have all those side effects and risks. So I'm not a personal fan of steroids, although in rare occasions, of course, I will do it. In addition, it's really all that insurance companies cover, sadly. So I see foot pain all the time, and I thought to myself, what could I do to treat foot pain that's safe, effective, natural, empowers people to heal themselves, and then lets the body do what it does best, which it heals. The human body has capacity in its immune system, in the structural integrity of the human body, to heal itself. We're able to heal injuries. We are able to heal sickness. You are able to take care of yourself. You do not have to rely on people like me, although I'm here for you if you need me. So if you have pain in the plantar fascia at the insertion point, which feels like a stone bruise or a rock in your shoe, if you have that pain, that heel pain, it's super bad in the morning, it's super bad after any cool down periods, like if you sit in the car for a long time, you get out of the car, you step, that's because this is all contracted and tightened up. You load it, and of course it's gonna hurt at the pressure points. If you're having that kind of pain, well, I've got a device that I put together to help you. Now, is it 100% effective for 100% of people? No. So don't get upset if it doesn't work for you. You might not even have plantar fasciitis. You might have tarsal tunnel syndrome. You might have a stress fracture. You might have fat pad atrophy. You might have an S1 radiculopathy. There's a million reasons to have foot pain. But if you have a true fascial component, a true mechanical foot pain that's based on a tight heel cord, a tight plantar fascia, and connective tissue abnormalities and disorder, then this should work for you. This is the healing soul. And what I did was I took a flip-flop, which is traditionally said to be terrible for you. Traditionally, doctors tell you don't ever wear a flip-flop. In fact, if you're watching this video, I bet you have heel pain, and I bet you've had a doctor tell you that. It's true, most flip-flops are not so great. I have some Havaianas. They're not the greatest shoe in the world. They do keep your foot from getting splinters, which is really the true nature and function of a shoe, right? But what I did was I just took a flip-flop, I incorporated a rocker bottom sole, I incorporated a structural foam, okay, that's rigid on purpose. So this is not going to be a soft, squishy like pillow-like feeling when you put it on, because that's not good for the foot. It doesn't do anything to improve your foot muscle strength. It doesn't do anything to improve balance. It doesn't do anything to improve your sort of proprioception or sense of position in space. But something like this with this nice textured footbed sole, which is also there by design because it stimulates certain nerve fibers in the skin to overcome pain fibers. That plus this structural integrity, plus it's really only soft right where, guess what? The plantar fascia is and the heel spur is. So that plus this rocker bottom sole, which allows that motion, so it decreases the need for all of your midfoot bones to move during gait, okay? So it automatically takes stress off of the muscles and the fascia and the connective tissue of the foot. Plus, in some of the shoes, we have this lifted toe raise that incorporates the wind loss mechanism. A lot of the shoes we don't, because a lot of people have great toe deformities, so you can't have anything to impede it. And then also, the flip-flop itself, what does that do for you? Well, it lets you use your foot muscles, which are important. Foot core strength is extremely important to overall longevity, to functional ability as you get older, to preventing falls, to keeping yourself from having a hip fracture. If you let your foot get weak and deconditioned, you're gonna have all kinds of problems. This lets you use your foot. And then finally, we have this metatarsal bar. It's not a true arch support, although it does support the arch. Rather, it offloads the forefoot. So this is awesome for people with forefoot pain. For instance, if your plantar fascia has most of its pain point here under the big toe, if you have a Morton's neuroma, if you've got synovitis of any of the big toe joints, if you have what's called metatarsalgia, which is doctor speak for foot pain that we don't know what it is. So if you have any of those, this shoe is designed to offload it, to stretch it, and to let your body heal itself by giving your body a chance. Your body senses gravity. Your body senses motion. There's little things called mechanoreceptors that they trigger healing. They trigger functional healing. So in other words, if your body doesn't sense motion and load, the tendons all heal sort of like this. If your body senses function and load, as it should during motion, everything heals up in line in a nice fashion, the way it's supposed to be in the vectors of force. It distributes things well. It lets your muscles work better. It makes your balance work better. So the whole reason I made this was not to be a 100% cure for 100% of the people, but rather a tool for you to use when you have foot pain that is far cheaper than a doctor's visit. It can be used over and over again. You can have pain one part of the year, use it, get over your pain, and guess what? If it happens again later in the year, you pull these out of your closet and you use it. It doesn't have the side effects of the injection. It certainly doesn't have the side effects or cost of surgery. It doesn't even have the cost of an injection or a doctor's visit. You don't have to sit in an MRI to get told that the MRI showed nothing, because generally speaking, it doesn't show anything with plantar fasciitis. It merely shows that the fascia is 6 millimeters thick versus 2 millimeters, which really you kind of knew if you had that diagnosis anyway. So I think a lot of people think sometimes that a device like this is meant to cure every one of their problems. It's not. This is just a great shoe to use if you have heel pain, to empower yourself to get better. Well, guess what? You still got to go to soccer games. You still got to take your kids to piano lessons. You still got to make dinner. You still got to go to work. You still got to take a shower. You still got to put your makeup on. And you probably nowadays have to start wearing high heels to work. So when you come home, put this on, get on with your life, give your body a chance to heal, let your plantar fascia feel better. That's all this is for. I wear them. Lots of people in my family wear them. We've got thousands of people out in the world wearing them. Most of my patients use these. It's a simple thing, but that's how the world works. The simpler it is, probably the better it is. And yes, it's a flip-flop. And yes, your doctors will probably poo-poo it because it's a flip-flop. But think of it as a treatment or a adjunctive treatment to your current plan disguised as a flip-flop. That's how I think of it. And that is what I did for plantar fasciitis, because heel pain is no good for anyone.